Hello everyone, or whoever is watching now. Yeah, today I'm just here to tell you more about family planning. Yeah, basically you find that most of the time people really get disturbed by this by these hormonal methods. Yeah, so hormonal methods family planning are things like implants, Depo, the injection for 3 months. We have pills and emergency contraceptives. Most people really ask more and more about these hormonal methods. They experience the side effects. And we know so well that those who have used it, most of the side effects include mood swings. We have things like bleeding or menstrual changes. We also have things like body changes. Some gain weight, some also lose weight. Some have also reported libido loss or lack of sexual interest. Yeah, so these things have been reported. Some also experience things like nausea, especially the ones that use pills or emergency pills. So these things are there, and most people also report delay in conception, especially when now they want to do what? To conceive again. So unapata somebody has been using a method, a hormonal method, so now they want to conceive and hakuna mimba inakuja. It becomes an issue, it becomes a battle even with the spouse or the husband. Yeah, so basically it happens. Bodies are different. Of course, some people go well with them, they don't experience such complaints. Some experience them, so it is usually individual based. Every method goes differently with every individual. Yeah, so you advise that in case you have a delay in conception, because that is usually the biggest bone of contention at that point. When you have a delay in conception, one thing you must know, if you are using a hormonal method, you must know that the hormonal imbalances are still there in your bloodstream, and you have to give yourself time, like a year or two, before your body readjusts. Not everyone delays conception. Some conceive immediately. But once you experience a delay in conception, men, we advise or we encourage you to give these women adequate time so that they heal from these hormonal imbalances. So once they heal, they can conceive. And then conception, you just don't put it in your mind that I want to conceive, I want to conceive. It may not come. Anxiety, to some extent, prevents pregnancy by not releasing a hormone that is responsible for pregnancy. Yeah, once it is released from the brain and it goes to the bloodstream, the anxiety hormone, it brings about confusion in the hormones, something like that. So when you want to conceive, you just relax. The pregnancy will come at that time that you don't even expect. So again, we usually advise that when there is a delay in pregnancy, you can visit a gynecologist to prescribe for you, or a doctor to prescribe for you a drug that contains progesterone hormone, so that it really helps to boost. You can as well take the pills, the combined oral contraceptive pills. That is the Femiplan from the market. It's known as the Femiplan. So you can take it to assist in balancing the hormone. Then you now break and give yourself time. After which, I think if things go well, you can conceive, if there were no any other factors that were delaying that conception. Note that if there were no other factors that were delaying that conception, then you can conceive afterwards. Yeah, so there is a method that really doesn't disturb people so much. This is coil. The side effects are very minimal. These are non-hormonal one. We also have a hormonal coil. Coil is the IUD. So we also have the non-hormonal one called the Mirena. That is the trade name. Yeah, this one here. You can see it. Are you able to see it? This is it. These are plastic. So whatever is inserted is not a whole thing like it looks. Usually we just insert this part here. This is what rests in the uterus, this one here. So this is hormonal. It takes 5 years. Then we have the non-hormonal, which I'm telling you has very limited challenges or side effects. This one here. So this is the copper T. It is coated with copper here, here, and here. Coated with copper so that when the sperm comes, it traps the copper ions, will trap the sperm and kill it there and then, so that it doesn't reach the egg or the ova from the woman. So that is basically how they work. This one has a hormone that is called progesterone. So the hormone itself usually also may have side effects like the hormonal methods that I earlier mentioned. Though it's really good for people who usually have heavy periods, it helps to control bleeding. Even sicklers can use this. Those with sickle cell anemia, they can use the hormonal IUCD as the best preferred method for them. Yeah, so basically that. I am preaching IUD. I am preaching IUD. IUD, IUD. Kindly use IUD and avoid these other methods if you have realized they have challenges. To be on the safer side, we didn't say they're bad. They are also good, but the side effects really disturb women. So that's all for now. Kindly follow me, like, and share. Bye for now.